May I come in, sir?
No, doctor.
Good afternoon, sir.
Right away. You want to be interviewed in English or Hindi?
Sir, English.
You are from AIMS Patna,
Yes, sir.
2021.
Yes, sir.
So you have spent your long years of childhood in Patna only?
No, sir, I am from Aradia. So, childhood was in from Aradia, and from graduation I have done from Patna, sir. So, last 6 years I was in Patna.
All right. Other than AIMS Patna, what are the prominent medical colleges in Patna?
Sir, one of them is the Patna Medical College and Hospital. Sir, other is Indira Gandhi Institute of Medical Science. Sir, these two, and sir, other is the sir.
Which is the oldest one?
Sir, PMCH one is the oldest one, sir. Yes, sir.
Okay. So you did not prefer to go to PMCH, which is such a old one?
Sir, that the year in which I gave the examination was the AIMS, and sir, other institute examination was conducted separately, and I have not able to qualify for the. I am able to qualify for that PG in UG entrance examination of that state medical college, and also sir, but my rank was not that good, so I was not getting that college.
I'm getting it.
Yes.
In which way AIMS Patna resembles AIMS Delhi? Or other than the name, there is anything else?
Sir, quality of healthcare services, and also sir, funding is from the central government, and also sir, the quality of educations which are being provided is more or closer towards the AIMS Delhi, sir.
You belong to Bihar and you are a doctor.
Yes, sir.
What is the main health burden of Bihar? Where the main challenges lie?
Sir, there are the tuberculosis is one of the disease which have highest burden, sir. And sir, other is the, sir, coming to the infectious disease, sir, lymphatic filariasis is other. And sir, in the maternal and child health care, sir, Bihar's infant mortality rate is also more than the national average, sir. And sir, also there is a increase in the recent time. There is an increasing trend of non-communicable disease such as diabetes and hypertension.
Why TB occurs so heavily in Bihar? Reasons?
Sir, one of the reason I can think of that sir, Bihar's population density is very high, and also sir, there is a high case of tuberculosis because of the rapid transmission among the people, and also sir, the nutrition level of the people of Bihar is low compared to the national average, and also sir, nutrition is one of the factor in which the immunity gets down so that the TB can be transmitted easily. So that's the factor I can think of, sir, which is
what the Bihar government is doing to tackle TB.
Yes, sir. Sir, the Bihar government, in accordance with the central government scheme, Bihar government is also implementing the rapid testing facilities, and at the PHC level, sir, designated microscopies are being set up so that the testing can be improved. And also, sir, in the last year, the government of India has taken steps of Prime Minister TB Mukt Bharat Abhiyan to eliminate the TB by 2025, sir. And in that manner, the Nikshay Poshan Yojana has been started to provide the nutrition support to the patient, and more testing at the grassroots level, and more awareness regarding the stigmatizations of TB so that people can come ahead and do their testing voluntarily, sir.
Has the incidence come down after government intervention? What does the data say?
Sir, the last year, sir, Bihar's TB notification rate was just 67%, but this year it has been increased to approximately 80%, which is at the same level of the national level, sir. And also in the TB notification, Bihar's incidence has been increased, which is showing that we have taken testing at a more strategic level, sir. So in that manner, and also that the disease burden has come down, but not in a significant manner, but it has come down. And also, sir, the COVID pandemic has little bit caused disruptions in the testing facilities. So, but recent time it is been catching up with the national level, sir.
Okay, Suraj.
Thank you, sir.
So basically you are a pediatrician, isn't it?
No, sir, I'm not.
You are not a pediatrician, but you have done It was a part of it. The pediatrics was part of your
Yeah,
MBBS course.
Yes.
What was your personal interest out of all this?
Sir, my personal interest inclined towards the community medicine part, sir. Because it helps me to cater to work on the ground level and to take the considerations of the communities, and also it will help me in coming to the policies cycle part.
Now, does the normal method for community medicine handling, does it apply in the case of, say, pandemics?
So pardon, sir, I'm not able to.
See, COVID was there, everybody knows.
Yes, sir.
Now, the community medicine normally deals with a normal situation,
Yes, sir.
not for emergencies. Now, those methods, are they applicable in the case of emergencies also?
Sir, as far as I can think, sir, that community medicine is not catering the emergency part, because there is a separate department for emergency medicine. But during the pandemic time, community medicine plays an important role in raising the awareness among the people regarding the preventive aspect of the disease. And also, sir, it helps in the community medicine, helps in the raising the sensitization among people, and also at the grassroots level, so that the nutrition part, so the basic sanitation
No,
part.
that is okay, but the difference lies in the number, in the size. Your community medicine machinery
Yes, sir.
is not that big to handle a real big emergency. So then what can you do? Can you upgrade or uplift this machinery to handle a pandemic of this size which you have seen all of us have seen?
Yes, sir.
Now, is COVID again recurring? You know, there are some reports also. So what is your personal opinion as a doctor?
Sir, in the December month, there has been cases of JN1 variant of COVID-19 virus, sir. And it is I do not think that it is again becoming the same situation which was happened in 2020 time, because now our health system is more prepared to handle any such time. And also, sir, our immunity has been boosted towards that, sir. The natural immunity has been developed to handle this situation. And also, sir, due to genetic mutations sometime, it has been incorporated in our gene, so that similar to the influenza virus which has been happening in time.
What is the link between, say, swine fever and COVID?
Sir, swine flu virus was also coming from the animals. Pig, it was the origin from pig, and COVID virus was also the zoonotic disease which has come from the.
That means COVID is a kind of a subsequent generation of swine flu virus.
Sir, no, it was not a subsequent generation. It is new virus.
Mutated. It is a new virus.
New virus, sir. It is a mutated and it has been new virus.
Now, what are your hobbies?
Sir, I am sir, loving the cooking Indo-Chinese cuisine, and also, sir.
What is Indo-Chinese?
Sir, it is mainly the Chinese food, such as the fried rice Manchurian, which has been Indianized, sir, like by adding the Indian ingredients such as ginger, garlic, etc.
What are the a few names which have been Indianized? Some Chinese or other dishes?
Sir, there are various, sir. So one of them is the fried rice, and sir, Manchurian, such as gobi Manchurian, paneer Manchurian, and sir, chicken chilies, paneer chili.
I read somewhere
Yes.
that this Manchurian, there is nothing like this in China. It is only an Indian imagination. There is nothing like Manchurian.
Sir, I am not aware of the exact origin of this Manchurian, but sir, it was made in the just like the pakoras which are making. But here, sir, we immerse the pakora, the Manchurian ball, into the sauces which are mainly of the Chinese origin, such as soya sauce, tomato sauce. These are basically of the Chinese origin, sir.
Okay. You have interest in law to some extent? Law, legal aspects of the country, judiciary system. Do you have interest in that?
Sir, I have read during my preparation. I have not much core interest in that.
So tell me that what exactly is the problem before the judiciary at the moment?
Sir, may I think for a moment?
Yeah.
Sir, there is a huge pendency of cases in the judiciary. Sir, the second is that the judicial system, the appointment of the judges, which are through the collegium system, it has been in the questions because of the lack of transparency mechanism. Sir, the third, which
What is your view about the appointment of judges?
Sir, the government of India has brought the NGSC bill, but it was struck down by Supreme Court, citing that it is
No,
against.
what is your view? Whether it should be, should not be, what reforms can be done? You are only describing what has happened, that is okay. But what should be done? What is your view on this?
Sir, I think that there should be some reform in the appointment of judiciaries, because it is the opaque system, and also sir, during the appointment, the senior most judges are being superseded sometimes, but there was no reason, any reason was citing on that, sir. And there should be some mechanism so that the inclusive appointment can be done, because there is a less number of women and the vulnerable sections.
Do you think the formation of an All India Judicial Service is okay?
Sir, in my opinion, there should be, sir, it is a good step, but more need to be done, that it is only giving the full power to the executive. There should be some system of checks and balance, such as that, sir, we should follow.
All India Judicial Service.
Yes, sir.
It's a new service which can be formed. So do you think that this kind of service should be formed, created?
Sir, I think it is a good step. It will help in the fulfilling of vacancies at a faster level, sir. And also it will bring the diversities in the judiciary, which is the need of the time, sir.
Do you think there is a case for putting some limitation on the number of appeals to reduce the cases? For example, now you can have, I think, how much, about 4 appeals. Now, should we cut it down to 2? Under Constitution, of course. Will it cut down the cases?
Sir, I think that the appeal system of the Indian judiciary is, as per me, it is working well, because if we do not provide the chance of appeal, then the decisions, the peoples will not be satisfied with the decision, then he cannot be able to approach to the higher level. So I think to get the justice...
There is a theory of appeal again. So don't go to the fundamentals. The question was whether it should be limited to 2. Those rights are there, it is all there, that is why there are appeals.
Sir,
but should it be limited to 2 to clear the cases?
Sir, I think no, it should not be limited to 2. More such facilities should be accommodated so that the rapid pendencies of cases can be declared by taking more cases, by making some more judicial benches and more...
You have any interest in, say, films, music or any such thing?
No, sir.
Not at all?
Not.
Why?
Sir, I am listening to some, but I am not much interested.
But you are not much interested.
No, sir.
Now, don't you think that some kind of this kind of input in the personality is good?
Sir, yes, sir, it is definitely good, sir. I will develop in future if I will get a
If you
chance.
get time, yes.
Yes, I will get time. I will develop this hobby, sir.
Last question. Now, where do you want to see yourself after 15 years?
Sir, I think I will see myself as a successful person and also contributing positively to the society in as per my capabilities. What will be my capabilities, sir? And also, sir, in my
It means nothing. You see, where do you want to see means specific.
Sir, first of all, sir, I will seeing myself contributing to the society in a productive manner, becoming the asset for the countries, and also, sir, working in the ground level to contribute to the societies, and also, yes, sir, that's what I am thinking.
Okay.
Thank you, sir.
There is a lot of concern about low public expenditure on health in India.
Yes.
So do you feel this is justified? What is the low public expenditure and what is the prescription?
Yes, sir. Sir, the last year budget has given the expenditure to the health sector at 2.1%, sir. But as per the national health policy, it was recommended at 2.5%, sir. And also, sir, many emerging countries such as South Africa is spending 8% of their GDP in the health. And seeing the health indicator of the country, it is imperative to boost up the expenditure and also to collaborate with the private sector to bring in more investment for the rapid.
So is spending on health, is that in itself a good strategy? What else is needed? We are spending so much on other sectors, but is the result commensurate with that expenditure?
Sir, spending in the health sector is one of the factors, sir, but more need to be done at the ground level. The existing infrastructure which is there, we need to develop, we need to institutionalize them, that they run in a good manner. And also, sir, at the ground level, the preventive aspect of healthcare is lacking, sir. So we need to focus on the preventive aspect of the healthcare by integrating the Ayush medicine in our system so that the preventive part can be taken care of. And also, sir, the quality of medical educations need to be improved so that the people can willing to work in the ground. Yes, sir.
So along with the financial part, there is a talk of outcomes as well. The government presents an outcome budget along with the financial budget.
Yes, sir.
So what type of outcomes are expected? Have you had any occasion to look at the outcomes which the various schemes project?
Sir, I have seen that in the National Tuberculosis Elimination Program, the government has targeted of eliminating the tuberculosis by 2025 and reducing the incidence by 90%. And sir, also in the infant mortality rate part, sir, it is outcome of reducing the infant mortality rate to below 26 per lakh birth, sir. And also that the health is
Fine. So the previous budget, it had announced a mission for eliminating sickle cell anemia.
Yes, sir.
Huh? So why is this problem acute now?
Sir, sickle cell anemia is one of the prevalent disease among the tribal population, sir, because they have the mutated gene itself present in their body. So that's what, and also, sir, sickle cell anemia is causing death among the tribal population. So that's why, seeing the conditions of the tribal population, it has been putting emphasis on the sickle cell anemia, because earlier that more diagnosis was not has been taken care of, and also the treatment was available only at higher center earlier.
So do we have a regulator for the health sector?
Yes, sir. Sir, which is National Medical Commission. And sir, National Medical Commission for the doctors and for the medical education. And sir, the Ministry of Department of Pharmaceuticals, such as sir, it has the Central Drugs Control Organization, which is taking care of the drugs part, sir. And also the National Health Authority, which is taking care of the Pradhan Mantri Ayushman Bharat Jan Arogya Yojana scheme, sir. So we have different regulators regarding in the.
So are they independent regulators or are they part of the system?
Sir, in the manner, sir, NMC is functioning independently, sir. Yes, but the Ministry of Health is the pioneer at the apex level, but it is working independently.
And what are the problems regarding health insurance in India?
Sir, in the upper segment of the people, which is the high income population, are taking the private health insurance scheme, sir, and the lower section is taken care of by the Ayushman Bharat Yojana. But sir, there is a middle 30% of the population which has been not covered under any health insurance scheme. So the first part is that. The second part is that the compliance of health insurance is very low, because the terms and conditions are very stringent of the insurance, and many people are not aware of that. So while claiming their insurance, many insurance companies are not providing them the complete reimbursement. So the third, the insurance premium is very high. So government need to put some policies that there should be some capping on the insurance premium, and also to lessen down the stringent policies by them. And also, sir, in the recent times, sir, the insurance body has come up with the cashless everywhere scheme, so that the people can avail the cashless facilities in each and every hospital.
And what is the pricing policy for drugs? Is there a cap on the prices that they can fix, or are they free to?
Sir, there is an agency as National Pharmaceutical Pricing Authority, which has been putting the price cap on the generic medicine, but there is no price cap on the fixed dose combination drugs or any brand fixed dose combination drugs, sir.
So what is your view? Are generic drugs inferior to the branded drugs? There is a general feeling among people.
Sir, I do not think that generic drug is inferior, because there is no any evidence regarding that, because I have not found any data on that, sir. And there is a perception which has been enforced by the pharmaceuticals companies towards the patient, and also there is some incident of doctor pharmaceutical nexus that doctor forced the patient to use only the branded medicine. And as far as the Drug Standard Control Organization and the quality control mechanism is considered, I do not think that, sir, the generic medicine is of any low quality, sir.
Okay. Lastly, these mental disorders,
Yes,
they are increasing
yes.
at a very rapid pace. Mental depression, they are becoming very common. And alongside, on the economic side, we have a talk of economic depression. So do you see any link between mental depression and economic depression? Are they similar in nature? Can one come up from these depressions?
Sir, may I think for a moment?
Yeah, sure.
Sir, mental depression is caused due to various factors, sir, social, economic, and sir, educational factors also. And sir, sir, the economic depression will certainly cause the mental pressure, mental depression of the people, because if the persons are not well, economically well, then he could be not mentally healthy, sir. So I think there is a linkage between them. And sir,
Okay, okay. Like what I meant was like mental depression is due to physiological and various other
Yes,
factors.
sir.
Economic depression is due to economic reasons
Yes,
or
sir.
other reasons.
Yes, sir.
So just like a mental disorder patient, he can be cured with drugs. So economic depression, is it also a simple thing that you can treat it in a similar manner? Like the economy, if it goes into depression, are there simple techniques like administering a few drugs and the economy will pull up?
Sir, to pull up cater the economic depression, we need multi-stakeholder approach, sir. Such as from the fiscal policy sides, we need to incentivize for more spending, and also we need to provide them with the money so that they can spend more. And from the private side, sir, the private sectors need to boost their spending so that it will help in the crowding in facilities, sir. And also mainly the economic concerns hampered the lower section of the society. So government need to provide them welfare benefit also, sir.
Thank you.
Thank you, sir.
Suraj, is this your photograph?
Yes, sir.
Tell me 3, 4 or 5 points, best parameters of Araria, and you are telling me so that I settle down in Araria. 4 or 5 points. What the best parameters?
Sir, may I think for a moment?
Sure.
Sorry.
Sir, the first point which I think of that Araria is situated in the northern Bihar region. It has good climatic conditions, sir.
Good.
Sir, second point, sir, Araria has also one of the first biodiversity park in Bihar. It is situated in Kusi, sir. Sir, the third, it is strategically located nearby Nepal, so we can have the tourism facilities also in the nearby area, sir. Sir, fourth, the populations of Araria is very young, sir. So it will, in the nearby time, it is anticipated that our industries will settle there. So it will provide more investment opportunities and, sir, in the more happiness life, sir.
Okay. Now, Suraj,
Yes, sir.
I will counter it with 4 or 5 parameters. Medical facilities have been very poor in area. So is the education. 20% of the population doesn't have this thing. Electricity is erratic, and it has a poor connectivity, road connectivity. Generally, when I want to settle down, yes, those points are very well said. These are the things. Now my question comes, you get into by your own efforts, by your own conviction, by your own labor, you get as your first choice as IAS.
Yes.
And you are posted in Araria.
Yes, sir.
Tell me, what is your priority, 3 priority areas which you would like to tackle?
Sir, the first thing I want to taken care of the education sector, sir,
Yes.
because there is a poor literacy rate. So if the people can be literate, they can take part in a
What is the
productive.
literacy rate in Araria?
Sir, it is approximately 63%, sir.
Or is it 53%?
Sir, yes, sir, 53%. Yes, sir.
Yes.
Thank you, sir. Yes, sir. 53%.
Very good. Education is the first thing.
Sir, second thing which I can think of is that the waste management problem is very high, sir, in the area. Sir, because of the waste segregation, waste is spreading inside open area, sir. It is causing much of the health problems, sir.
Yeah.
Sir, the third, in the health sector, there is the doctor facility is poor, sir, in the area. So we need to work on that part, sir, also. Sir, the fourth, sir, there is a lack of industries in Araria, sir. Araria is one of the largest producers of makhana, sir, which is also coming in the one district, one product of Araria. So we need to boost the food processing industry in Araria so that can provide employment opportunities also.
Now, health, which is your own specialized field,
Yes, sir.
health is generally one is that strengthen the primary health center.
Yes, sir.
Then the private hospitals have come. Okay. Now, what will be your strategy to improve the government health sector there already existing?
Sir, in my district?
I'm talking about your district only. I'm still on area.
Yes, sir.
And I will remain in area. I will end up with area.
Yes, sir. Thank you. Sir, may I think for a moment?
Sure.
Sir, first, sir, I would assess the situations of my district hospital. What is the facilities or what is the conditions are lacking in that? Second,
What is those lacking?
sir, the
Yourself
doctor.
and,
Yes,
doctor,
sir.
tell me
Sir,
what
doctors are not coming regularly.
Yes,
First,
absentee doctors.
absentee doctorism. For that, I can start, sir, that the biometric attendance system and also meeting with the medical officers of the district, so and provide the stringent penalties if they will not come regularly. Sir, second, sir, there is a lack of paramedical staffs also, sir. So we need to go to the ground level and volunteer the more ASA workers to come so that they can take care of the preventive part. Sir, third part, I think that, sir, the medical equipment is also not up to the mark in the hospital.
Very true.
Sir, for that, sir, we will seek support of the higher level government and we will provide them, sir, in simple instruments such as, sir, BP machine, glucometer, sir, that can be taken.
Now my last question.
Yes, sir.
Have you heard the name Mare Gaye Gulfam?
Yes, sir.
Tell me about it.
Sir, it is a poetry of
Story.
of Phanishwar Nath Renu, who is the poet of born in Aradia, and also, sir, he has written many other poets, sir, like the Maila Anchal. And sir,
Story, all are not poets, they are all story.
Yes,
Now,
sir,
tell me, how the very right, you said you don't know, but lovely, on the films when you sir asked, tell me something about this Mare Gaye Gulfam, a movie was made on this.
Sir, Teesri Kasam movie was made on this, sir, in which, sir, Raj Kapoor and Wahida Rahman were the actor and actress.
How the movie is related to Araria?
Sir, it has shown that the Araria is also a border district, sir, and also in that the main actor Raj Kapoor, who is the, sir, I am forgetting the name of that personality. He is transported.
The shooting was done in Araria.
Done in Araria. Thank you, sir.
I told you I will remain on Araria.
Yes, sir. Thank you, sir.
Awesome.
What is the function of the cortex in the brain?
Cortex. Sir, cortex is the higher sensory part of the brain, sir. It is regulating the several mechanisms and it helps in coordinations with other body parts like cerebellum.
Yes.
Cerebrum.
It coordinates the limbs.
Yes, sir.
In that regard, what do you know about the latest Neuralink development? What they have done? They are doing something about the cortex. What is it?
Sir, I am not read on this, sir. I will read this. Sir.
You don't know anything about Neuralink? What is Neuralink? Elon Musk? You don't know.
Sir, I know that he has developed something related to that can be taken, but I am not
Okay,
read on this.
no, there's no question of asking.
Yes.
What is AMR?
MR.
AMR.
Sir, it is antimicrobial resistance, sir. Sir, that means that our body will not responding to the drugs to take care of the bacteria which are emerging in the body.
How it develops in human body? What are the factors responsible for AMR?
Sir, there are various factors, sir. First, the overuse of antibiotic drugs. Sir, second is the incomplete completion of the course of antibiotics. The patient thinks that they have no disease, no ailment is now, so they stop taking the medicines, sir. Sir, third is in the hospital sector, sir, due to sanitation's problem, and also, sir, the antibiotic is used in the farm sector also, so which is getting transmitted to the body. And sir,
That's okay. What is superbug?
Sir, superbug is another name for the antimicrobial resistance bacteria, which has been not responding to any of the other medicines available, and it has been developed into more super powerful forms.
Are you aware of a super antibiotic that has been developed to go for such resistant antibiotic bacteria? Are you aware of that?
Yes, sir. Sir, last month there was a news that the new antibiotic has been discovered through the use of AI, and it was I am not aware of the name, sir, but it has been developed to take care of superbugs, sir.
All right. What was your optional paper?
Sir, medical science.
Medical science.
Yes, sir.
All right. How do you look at the utility of ancient medicine system to treat modern diseases?
Yes, sir. The modern medicine is also the offshoot of the ancient medicine. I can say that, sir. There is a well. Earlier there was a lack of evidence, but now there is increasing evidence about that. Sir, osteoarthritis can be treated with the help of ancient medicine, such as the oil can be used in the treatment of osteoarthritis. And also, sir, the many diseases such as I said, sir, tuberculosis, the nutrition's part, the Ayush Ahar or the Ayurvedic Ahar we can take that can boost the immunity and will help to reduce the effect of the bacteria in our body, sir. And sir, the yoga and naturopathy can help to calm our mind, which can help to fight with the mental health problems, sir. So that
that's
can, yes, sir.
Have you been given any teachings in ethics at AIMS Patna, medical ethics especially?
Yes, sir. There was a course, sir.
There was a course.
No, not a course, sir. It was a 15 days program which is inculcated in our own curriculum, sir.
What they taught you under that?
Sir, the ethics part which was there, sir, there was a three things, sir: attitude, ethics, and communication. So first thing they taught about that how to communicate with the patient and their family members, sir. So second, how to break the sad news to the patient part. So third, sir, they tell me in the ethics that you should do the justice to the patient. You should maintain the autonomy of the patient. You should not disclose any information which is should come out in the private, should not to the any other member, sir. Third, there should be that the non-maleficence to the patient, and you should done anything only towards the benefit of the patient, not to yourself, sir.
That's okay. All right. Thank you. Thank you now.
Thank you, sir. Thank you, sir.
ह्यूमन आया वो सुनते थे।
May I come in, sir?
Come.
This is your first attempt only?
Yes, sir.
Very good. From where did you prepare? From Patna?
No, sir, in Delhi.
दिल्ली आके तैयारी की?
Yes, sir.
एक साल रह के की?
Yes, sir. January में last year, I think.
ठीक है, very good. Very young medical student. See, you could interact and you could engage, and there will be a good number of questions from medical science.
Yes, sir.
Like AIMS also.
Yes, sir.
How to upgrade the standards of the new AIMS also. So give your views on that. But they're not at par with AIMS Delhi, which is very natural.
Yes, sir.
So, but you have to see that tomorrow they have to develop like that.
Yes, sir.
One is that. And then the entire medical landscape in Bihar, which is poor.
Yes, sir.
Infrastructure, upkeep of the patients, and then they'll ask you questions about private practice by the doctors, medical ethics. You should be very good in that.
Yes.
That will be your game changer in the interview. Now, some changes have occurred in the Indian Penal Code towards this negligence due to death due to negligence.
Negligence, yes, sir.
They have exempted the doctors.
Yes.
But you should know it exactly. It's not exactly that nothing will be done. In gross justice, in gross negligence, there is a punishment for 2 years.
Yes, sir.
So know the whole thing, what was the earlier one, what is the new one.
Yes.
This can be likely question.
Yes, sir.
Okay, that they can ask you.
Yes, sir.
And then of course some idea about ancient medicine, Charak and Sushruta, what kind of practices they did
Yes.
in India, their work and all that. Then this debate about this replacement of Hippocratic oath with Charak
Charak.
oath. What is this? Who has proposed it? What are the elements of how they are different and all that? Who is for that? Medical science में सब चीज़ AMR वगैरह सब
Yes,
पूछेगा
sir.
उससे.
Yes, sir.
Non-communicable diseases, TB, disease चल रहा सब पूछेगा. उसके बाद बिहार becomes your second thing.
Yes, sir.
बिहार has lots of problems. कहीं फ्लड आ रहा है, कहीं प्रोडक्टिविटी कम हो रही है, तो बिहार का एग्रीकल्चर इंडस्ट्री ये सब चीज़ को आपको देखना पड़ेगा विथ गवर्नमेंट डाटा एंड ऑल.
Yes.
You should know
Yes.
about all this economy and बिहार और अररिया पे जिनको पूछना था सर ने पूछ लिया, लोकल प्लेस पे पूछा ही जाता है.
Yes, sir.
That sound also. That's all I have to say. Otherwise न्यूज़पेपर तो पढ़ते ही रहते होंगे क्या हो रहा है नहीं हो रहा है.
Yes, sir.
इंटरव्यू कब है?
14th February, sir.
बहुत अच्छा है. सर will test, दादा सर will test. Right. Excellent.
Very good. You are good shaping into a good doctor. But let me tell you 2 or 3 areas which we did not go to. A very natural question about your getting so fond of IAS, particularly when you are already successful. So you have to have a cogent set of reasons for that.
Yes.
Number 2, I was pleasantly surprised that you said that you have no interest in films and all that. Then you remembered about Tisri Kasam. I mean,
Exactly.
and you mentioned the details also, Raj Kapoor and all that.
Sir, I think that more question. I have read only about the Tisri Kasam.
Only about this film,
Yes.
huh? Okay.
Yeah, but generally, suppose someone says, have you interest in painting? You can't say no.
Yes.
I have less interest. I do watch, I do appreciate, but on such things, you're going on the poster, the advertisement, these are all art making.
See, sir, you cannot just say that I have no interest.
Ah,
You don't
blunt
have-
no is bad
Yes,
for
sir.
hobby.
You can say that I would love to develop this.
Yes.
Yes.
That's a better way of answering.
Yes, sir. Yes, sir.
Okay. All the best.
What he said, building on this thing, what he said, why do you want to join this thing? तो उसको उससे भी link कर लो जिसमें what you hinted upon, preventive aspect is more important. So you can say that by joining this thing, I can look into those aspects which lead to the diseases. It is not only about medical treatment or medicines. और वो
देखो
public
भाई-
expenditure में भी efficiency is more important.
Yes.
In ensuring efficiency of whatever public expenditure is being made. So there also administration can have a major role.
Yes.
By improving the overall systemic deficiencies. इस तरह से बैलेंस कर सकते हो.
हेल्थ तुम्हारा बार बार बोल रहा है, यू विल कैरी दैट डे ऑन द बेसिस ऑफ हेल्थ. अदरवाइज वो पूछ देंगे हाउथी पे तो नहीं जानते हो, तो न्यूयॉर्क पे तो नहीं जानते हो, चलेगा, सब चलेगा, थोड़ा बहुत जानते हो नहीं जानते हो. हेल्थ पे अगर तुम ठीक कर लेते हो, यू विल बी जस्टिफाइंग योर कैरियर कि मैं मेडिकल में हूँ, हेल्थ में मेरा स्ट्रॉन्ग है, वो भी हमसे प्रोडक्ट.
Yes.
तो मेक इट योर स्ट्रॉन्गेस्ट पार्ट ऑफ योर इंटरव्यू हेल्थ. एंड सेकेंडली बिहार को हेल्थ से रिलेट करके तो
Yes.
इसमें लगा अगर चल गया, शुरू होगा उसी से शुरू होगा तुम्हारा. उससे शुरू होगा, उसमें अगर 4-5 क्वेश्चन अच्छे से कर दिए तो एक फील गुड फैक्टर आ जाएगा कि दिस स्टूडेंट नोज अबाउट दिस. फिर हम पूछें, अब तुमसे एक्सपेक्ट करें कि आईआर के एक्सपर्ट बन जाओ, तो इट्स माय मिस्टेक. यू आर अ मेडिकल डॉक्टर, यू डोंट हैव टाइम टू रीड.
Yes.
मुझे पता है 5 साल तुम मेडिकल कर रहे हो. फिर हम तुमसे पूछते रहे कि यहाँ पे क्या हो रहा है, वहाँ पे क्या हो रहा है. तो अवेयरनेस होना चाहिए, रेड सी में हो रहा है, हाउथी वहाँ अटैक कर रहा है, इजराइल हमस फायर कर रहा है, बट दैट विल डू.
Yes.
बट मेडिकल में माफी नहीं की जाएगी.
Yes.
प्रॉब्लम्स इन दोनों चीजों को लेके चलो. और कुछ पूछना चाहते हो?
सर कम्युनिकेशन में रख सकते.
सब ठीक है तो
अच्छा है.
अच्छा.
अच्छा कम्युनिकेशन. यू आर गुड फॉर योर एज एंड योर क्वालिफिकेशन.
नहीं सर, मतलब स्पीड तो ज्यादा नहीं है. क्योंकि
नहीं,
इसमें क्या होता
नहीं.
सब समझने वाले हम सब समझ
नहीं क्या बताया था?
नहीं सर.
मेडिकल एथिक्स में क्या बताया था? कम्युनिकेशन. वैसे ही कम्युनिकेशन करो, इट्स ओके, गुड.
You normal thing is very
In
good.
fact, the RPI is a very important sector in the aims of पढ़ा रहे हैं कि how to communicate with the patient, how to communicate with the relatives or the very good. I have done a course in Johns Hopkins University on that. Thank you, very good. You do well.
Yes.
Communication comes out from your body.
Body.
Entire thing. It is not only what you are speech.
Very good.
So, बढ़िया है. You are confident you can.
कब है इंटरव्यू?
14th February sir. 2 weeks. time.
अपने ऊपर हो, न्यूज़पेपर पढ़ो.
Yes.
Be yourself and you are good.
Thank you.
Okay. All the best.
Thank you so much.
और हैं अरविंद माया.
अभी है.